My name's Dr. Matthew Duke. I'm an osteopathic physician. I work here at Abrazo Medical Group in Buckeye. Grew up in Buckeye, so I'm a native, as is my wife, so it's nice to be hometown doctor to the hometown you grew up in. I've been married for 25 years this year to my wife. She's also from Buckeye, so we were high school sweethearts. We recently just took up ballroom dancing together because the kids were gone, so we found something we could do together. When I was about 8, I broke my arm really bad, and I decided it would be neat to be able to fix people. So I've been wanted to be a doctor ever since then, and that's everything I've focused on throughout my career. The idea of osteopathy is that it's the same base training as medical school from an MD standpoint. We look at the body more as a whole unit. A sore ankle may lead to a sore knee that can lead to a sore hip, so if you fix the ankle, then the hip doesn't hurt. There was one patient in particular that I always tell all the med students who I have with me about. We were just doing a routine physical on him, no specific complaints. We did his routine blood work, and his protein level came back slightly elevated on his blood tests. And as it turns out, he had multiple myeloma before he had any symptoms whatsoever. He went on to get treated, had his bone marrow transfusion, all seamlessly without ever having any complications of the disease. A case like that where you find it before there's even symptoms just because you're paying attention to the patients is something that I really enjoy to do with family practice. I hope to have imparted on the world that having personal relationships with my patients, it's nice to be able to let them know that we're also people. We just have training in something that can help you. My approach to patient care is that I think the patient should be in charge of their own care. I'm here to guide you along the medical way. You may not know a lot about what your body's doing, but if I'll listen to you enough, you'll tell me what it's doing so I can then translate it into medical terms for you what it's doing. So we try to encourage them to, change lifestyles, eat healthily, exercise as much as they can. Your lifestyle is going to do more for you than I can do for you from a treatment standpoint in most situations.